So we can see that cortical bone is comprised of osteons, which are approximately 50 microns in diameter. These are formed by 5 to 7 concentric lamellae with a herringbone arrangement in terms of the collagen 1 fibres. The osteons are arranged with the longitudinal axis parallel to the long axis of the bone, and this is according to the lines of force that go through the cortices of bone. This gives cortical bone its characteristic anisotropic properties, and it has a much greater stiffness in comparison to trabecular bone, with a Young's modulus of 20 gigapascals in comparison to trabecular bone, which has a Young's modulus of 1 gigapascal. In terms of the blood supply, we can see that there's a central haversian canal with a neurovascular bundle running perpendicular to this. We have transverse Volkmann's canals, and this network of blood vessels connects the inner endosteal surface with the outer periosteal surface, and we know that the blood flow in bone is centrifugal. So that's from a inner high pressure nutrient artery with blood flow centrifugally outwards towards the low pressure periosteal surface. Around the outside of the osteon are cement lines, and these are potential areas of weakness where cracks can propagate. There are no collagen fibres which cross the cement line. If we compare this structure of cortical bone to trabecular bone, we can see that trabecular bone is macroscopically a 3D lattice or network of trabecula. In terms of one of the trabecula, we can see that these are formed by parallel sheets of lamella, and these again are arranged according to lines of stress in the bone. Cancellous trabecular bone has a honeycomb appearance. It has a much greater porosity of 30 to 90% in comparison to cortical bone, which has a porosity of less than 5%. Trabecular bone has increased metabolic activity and greater surface area compared to cortical bone. If we look at the cellular arrangement, in terms of the cells in bone, we can see there are osteocytes interspaced between lamella with canaliculi, which allow communication between the cells to maintain the cellular environment, and similarly this is the case in the osteon. Particularly important in cancellous bone, the surface of the trabecula are the bone lining cells, which are flattened osteoblast derived cells. These have a gatekeeper function, so they undergo a morphological change when stimulated by parathyroid hormone, and this is by the cyclic AMP mediated pathway, and this then exposes the surface of the trabecular bone to osteoclasts, which are multinucleate giant cells derived from macrophage lineage with a ruffled border, and these absorb bone. Also communicate with the bone lining cells, and through cytoplasmic filopodial extensions, the osteocytes can communicate with the bone lining cells, and this forms an important role in terms of mechanosensation. So the osteocytes transduce stress signals from bending and stretching of the bone, and they convert this into biological activity through fluxes of calcium across the gap junctions, and this then regulates remodeling according to the stresses placed across the bone.